Community splash pads come with a disgusting health concern, the CDC finds. Public splash pads are popular attractions in many parks around the world, giving families with small children a cheap way to keep cool in the scorching heat without the risk of drowning. Unfortunately, the new CDC report has found that in the US, they've been the source of at least 60 waterborne diseases outbreaks since 1997, in spite of the measures taken to keep their water clean. The reality is that when you mix bottoms with water, fecal matter is bound to spread into the environment. We're talking about people's behinds, of course. That's especially true if the main patrons are wearing diapers, which is the case for splash pads, which with their minimal drowning risk are designed primarily for children under the age of 5. Young children are also less likely to have mastered toileting and hygiene skills, and swim diapers do not prevent fecal contamination of recreational waters, the report states. Sitting or standing on top of water jets and wearing diapers or swim diapers are behaviors commonly observed in children playing in splash pads. The former behavior results in rinsing of diapers or perianal surfaces, which in young children can carry as much as 10 grams of feces. The main solution to biological contamination involves filtration and a dose of chlorine. These are already common practices across many US splash pads, yet the report found a proverbial hole in the chemical gate through which Cryptosporidium, a genus of parasitic prostis that causes respiratory and gastrointestinal illness, can sneak. Because children typically ingest more recreational water than adults and have been commonly observed to place their open mouths on sprayed or jetted water, children are at increased risk of exposure to pathogens in contaminated splash pond water. The report draws on data spanning splash pond outbreaks and reported by public officials between 1997 and 2022 in Puerto Rico and 23 states. Overall, these outbreaks put 152 people in hospital, sent 99 people to the emergency department, and made 10,611 people sick. Thankfully, no deaths occurred in any of these cases. More than 2/3 of the outbreaks were caused by Cryptosporidium. This one little parasite was responsible for 91% of all cases of waterborne illnesses reported in the study and 81% of all hospitalizations. So most of it was from this. The CDC report suggests, in lieu of the chemical solution for Cryptosporidium, a set of clear recommendation users' behaviors together with more frequent water testing could help prevent future outbreaks, and these include not getting in the water if ill with diarrhea until 2 weeks after your diarrhea has stopped, not swallowing the water, taking young children on bathroom breaks or checking diapers or swim diapers every hour, and if needed, changing them away from the water, not standing or sitting above the splash pad jets. Splash pads are not only a surefire way to get kids having some much needed activity outdoor fun, but it has also helps families cope with climate change on the budget, especially those in marginalized communities and poorer areas. With these measures, we can all safely enjoy a good old-fashioned splash for many summers to come. This was published in the CDC's Morbidity and Mortality Weekly Report. This is on Science Alert by Jess Cockerill. Please leave your comments, and thank you for your support. Please support my Patreon account. The daily posts are 5 videos daily, and they are totally different from what I have on my YouTube channel. Thank you so much for your support and that you find all my content so interesting. You'll find the Patreon account details in the description box below.